So, here's the thing. The U.S. Centers for Disease Control and Prevention, that is the CDC, has released its long-awaited technical guidelines for cruise ships to sail again in the United States after a good long 5 months. The 7-page document of regulations represent a pathway for cruise lines to operate again in the United States, although with significant logistical hurdles designed to minimize the burden to the greatest extent possible on federal, state, and local government resources. You're watching Get Cruise Ship Info and more, and today, we're going to deep dive into what the CDC guidelines have to say and what we could possibly anticipate as a further course of action on their part. Before we begin, please make sure to subscribe to my channel and stay updated with the latest news from the cruise industry and much more. Now, without further ado, let's get started. In a nutshell, the CDC is asking cruise lines to demonstrate they can handle a COVID-19 incident themselves from a quarantine, healthcare, and transportation standpoint. You might be wondering then, where's the challenge? So, the CDC did not mention a date of when ships could sail, or even begin trial voyages. This is way beyond disappointing, as this does not serve the purpose of all those meetings, conference calls, and letters that were sent by various government officials and cruise lines to the CDC. Now, our only hope lies in anticipation of the dates that the CDC may issue, hopefully soon enough within the second quarter of 2021. Let's take a look at what the document talks about. The CDC recommended in its regulations that all port personnel and travelers, passengers, and crew receive a COVID-19 vaccine. The cruise ship operator must document the approval of all U.S. port and local health authorities where the ship intends to dock or make port during one or more simulated voyages or restricted passenger voyages as a condition of receiving or retaining controlled free pratique for conducting one or more simulated voyages, or receiving and retaining a COVID-19 conditional sailing certificate. The agreement must include a port operations component, including a vaccination component, a medical care plan component, and a housing component meeting the requirements. The CDC will require a presentation of proposals regarding how the cruise ship operator intends to incorporate vaccination strategies to maximally protect passengers and crew from introduction, amplification, and spread of COVID-19 in the maritime environment and land-based communities. The CDC is requiring significant embarkation screening and onboard protocols, including medical evacuation at sea for COVID-19 reasons. Protocols must rely on commercial resources, example, ship tender, chartered standby vessel, chartered airlift for unavoidable medical evacuation at sea, and be designed to minimize the burden to the greatest extent possible on federal, state, and local government resources, including U.S. Coast Guard resources. All medical evacuations at sea must be coordinated with the U.S. Coast Guard. The regulations also require significant disembarkation protocol should there be an outbreak. A cruise ship operator's agreement with all U.S. port and local health authorities where the ship intends to dock or make port during one or more simulated voyages or restricted passenger voyages must incorporate medical care agreements between the cruise ship operator and healthcare entities, addressing evacuation and medical transport to onshore hospitals for passengers or crew in need of care, in accordance with CDC technical instructions and orders. Cruise lines must also consider the potential medical care needs of travelers, including the capacity of local public health, port authority, hospital, and other emergency response personnel to respond to an onboard outbreak of COVID-19. Cruise lines must explain the factors relied upon by all parties in determining the capacity of the cruise ship operator's contractual shoreside medical facilities or healthcare systems. The agreement must consider where the ship will be physically located during the isolation and quarantine period, that is, at the pier or at anchor. The parties to the agreement must jointly consider the potential housing needs of travelers, including the capacity of local public health, port authorities, hospital, and other emergency response personnel to oversee and monitor the housing needs of travelers under isolation and quarantine. The agreement must briefly explain the factors relied upon by all parties in determining the sufficiency of the cruise ship operator's contractual or corporate on-shoreside housing facilities. Any shoreside housing must meet CDC guidelines. Precise instructions from the CDC can be referred to the link I've put down in the description. Please drop your comments down below. If you enjoyed watching this video, subscribe and like will be appreciated. Until next time, thanks for watching and stay safe.